Good evening. I'll be giving a few minutes for everyone to join in who want to come. Yeah, we have two in. We had a good day today. Right. Leave it one more minute. So I put a little description this time. So so if you look at that, you can follow along and explain what we're doing today. Okay, so start. So today's live is on trigger points. So the full name for that is myofascial trigger points, and I'll explain what that is. And as we go along, I'll try my best to explain the longer and more medical words. So the first point is to explain what the phrase myofascial trigger point actually means. So myofascial, if we're going to break that word up, and most medical words, you want to break it up so you get a better understanding of what the full thing means. So myo, so the myo bit of myofascial refers to muscle, and it's used as a prefix for a lot of medical names and conditions that involve muscle. And then the fascial, so the fascial bit of it is referring to fascia, which is the connective tissue that links the muscles together, and they're a little bit more fibrous than muscle. Muscles are a little bit more smooth. So, a trigger point is a hard, discrete, and palpable. Palpable means feelable nodes or nodules within a taut band, a tight band of skeletal muscle. So you're not going to find this in organs, only within the muscles that move the bones, so move the skeleton. Um, these trigger points can be present in muscle itself or the fascia in between, hence the name myofascial trigger points. So if we delve a little bit deeper into trigger points, we know that they are composed of loads of what we call contraction knots. So these appear as a segment of muscle fiber that's extremely contracted, with strands of filaments that are contracted as well, and they have an increased diameter in comparison with the fibers around it. Okay, compared to the more relaxed ones around it, and this is why it will feel like a lump is present. Um, so that's whether you can feel it by on yourself or us as clinicians will have a feel, and that's why it comes in like a lumpy sort of a texture. So you may be asking, okay, it's a little bit of contracted muscle, so why do they hurt so much? Or you might be thinking the opposite. Okay, I've got loads of these everywhere, and I don't feel them most of the time. So why is it an issue? And this is where you can categorize them into two types: the bad ones and the all right ones, I guess. So the first one, the bad ones are called active trigger points. So these are the ones that are going to cause the most clinical complaints, right? So they're always tender. They can create a recognized pain pattern to the client when it's compressed, which means that this pain can either be local, or referred. And I'll explain sort of the nuances of pain patterns and how pain works in a previous live, so I won't go into too much detail. But um, the pain could be where you press actually where the trigger point is, or it could be a little bit further down in the body or along that muscle itself. For example, if I were to go to someone's upper tract fiber, so like close to the neck here, you could sometimes they feel that pain up in the neck, and that's what referred pain in this instance is. Okay, so these type of active trigger points are known to be a problem in terms of physio because they prevent full lengthening of the muscle. And this proven in research. So it prevents full lengthening of the muscle. It weakens the muscle over time, and it mediates a local twitch response in the muscle fibers, which means they can be more prone to spasming. And that can happen when they're adequately stimulated. And you can see why all of these can be a problem in someone's function. Um, uh, where these type of trigger points pop up and the pain um, that is associated with this, if it's consistently happening, that's where we would then call it a myofascial pain syndrome because it's then becomes syndromic. Um, so that the pain that's associated with the trigger points is the syndrome, not myofascial trigger points themselves, right? So that's the active ones. The okay, so I'm seeing it keeps freezing, does it? Okay. Um, well, I'm just gonna keep going. I don't know whether it's the internet thing, but hopefully later on, if it comes up live, then then it will be fluid throughout. So David, if it keeps freezing for you, maybe just watch afterwards once it saves. Okay. So so as I was saying, the second type is latent. Okay. So these are the ones that are not, you don't get as much of a clinical complaint because they're a little bit more spontaneous. And it's only a problem when it's palpated, when it's felt. They may have all the clinical characteristics associated with active ones, but just not as persistent with the pain. And the main thing that the latent ones have are the restriction and range of motion. So that's the main function of that. Um, so following this, what are the reasons? So you may think, okay, what are the reasons for these trigger points? Like why do people have them? So there's an agreement that the most common risk factors with these are two things. Okay, so um, muscle overuse of any kind, and then secondly, direct trauma to the muscle. It doesn't have to have, so there isn't a really a cause and effect thing per se, because we don't have the research on it. So we don't know that there's a direct cause for the trigger points, but we know that there's general factors that play a role in the increasing the likelihood of them being present. Okay, so um, out of the two, so the overuse and the trauma, most likely is going to be overuse in most people. Okay, so overuse is another word for that is overloading. So in rehab, we speak a lot about loading just in the right amount. And I've spoken again about loading in a previous live, but you basically want to make sure that you're not overtraining and overloading. Um, so we can overload and overuse in various ways. So via low level or high level muscle activity. Okay, so with the low level, you're looking at sustained or repetitive low level muscle contraction. Um, so we know that even contractions that perform at only about 20 or to 25% of a maximum capacity, or the maximum amount that someone can contract, it's still high enough pressures to impair blood circulation. And once we decrease blood circulation, this can lead to increased amount of trigger points. So sustained contraction or repetitive low level contraction. Those are things that can are likely to be a risk factor in trigger points. And then you've got the more dynamic submaximal, maximal, and eccentric contractions, which are a lot more high volume and high force. Okay. Again, I've also spoken about eccentrics before in another live, but these types of contractions are going to occur in a more active population. So these will occur in the gym. So, for example, if you're going for a max squat and a max bench press, these trigger points can form in the muscles, and also the eccentric contractions, which occur during a lot of activities of daily life, but they've been researched a lot more in sports. So if you're thinking of overhead throwing, spiking in tennis, so a serve in tennis, a volleyball spike, javelin throwing, running downhill, jumping. These all involve eccentric activities, which is basically a muscle being active while it's lengthened. Okay, so these are the different things in life, in active life, that are going to cause trigger points. So basically, they can occur in any walk of an active population. Okay, so they are pretty prevalent, they're pretty common. So don't be too alarmed if you've got them, because they are quite common. So you may be thinking, okay, right, so I have a trigger point now, and I know, what could have possibly caused it. But what is it that I can do about it? They're going to be there. So what can we do? So anyone can get it. So we need to think about how you're going to prevent it. Okay. We don't know the specifics, as I mentioned, of why they happen on an individual basis, and we can't prevent them for certain. But there are measures that we could take to decrease the likelihood of it happening. Okay, and these are really important points that in your general life that you want to live by. So, firstly, you want to decrease stress as much as possible. Okay, so people who frequently experience stress and anxiety may be more likely to develop trigger points in their muscles, and this has been found in research. And the theory behind some of this research is that people are more likely to clench muscles when you are stressed. Okay, so I've had clients that come to me that say that they grate their teeth at night, so they have trigger points around the jaw and the neck. And as I said, as I mentioned before, the sustained or repetitive contraction is a risk factor. So that repetitive contraction is more likely to stress. So if you need to take measures in your life to try and decrease stress, and that will lead to less likely trigger points. Okay, so when you're looking at another form of trying to decrease the likelihoods, you've got to think about, right, if you are an active person, how can I make these steps to change the likelihood? So you want to have effective and strategic exercise plans in place. You want to warm up for long periods, and you want to be exercising often if you are very active in sport. Okay, so we know that muscle memory takes place. Muscles will adapt and change the type of exercise that you're putting them through. So if you're playing sport often, that includes eccentrics, I mentioned before, you want to train eccentrics. You want to train in an eccentric way that you're loading through lengthening, so that the muscles can adapt accordingly and be more adapted to that specific muscle type and activity type. On the other hand, you want to make sure that you're avoiding overuse, as you spoke about before. So you want to optimally and progressively load your muscles. And that's going to have a positive effect in decreasing the likelihood of trigger points in if you're a lot more active. Okay. The third point is you want to eat highly nutritious foods. Research shows that nutritional inadequacies are found to increase the likelihood and sensitivity of trigger points. Right. So you're gonna, if you eat quite well and are getting the nutrients, so vitamin B, C, folic acid, they can all result in reduce of into so if you are deficient in these vitamins, then you can have reduced tissue repair and metabolic function. You don't want that. That's going to increase trigger points, the likelihood of trigger points forming. So think about how you're eating and make sure that you're getting the correct vitamins and fibers. So to summarize, 3 things that we can do in a preventative fashion: decrease stress, effective warm-up with exercise, and effective exercise as well, and eating highly nutritious foods. Right. But even with all of this and trying to prevent it as much as possible, they can still form, right? So once they do form, you're thinking, okay, what can you do about it? And that's where we as therapists will come along. And its research shows that the most effective way is manual therapy, so soft tissue massage. There's mainly two techniques that we are focused on as therapists. So, as I mentioned before, the term myofascial, we would release that. So myofascial release, that's one form of soft tissue that we're going to really push for, and as well as soft tissue release as well. That's another form. Those are the two techniques. So we know that we need to, with myofascial release, that we're going to identify a layer of tissue that's causing discomfort. So you want to, i.e., the main muscle that has the trigger point and the surrounding fascia. So we want to, with myofascial release, what we're going to do is provide a manual stretch rather than just gliding over it like normal. And this can be done in 2 different forms: directly, so that would be deep tissue manipulation using knuckles, elbows, thumbs, and apply a slow sinking force that's gentle and gets harder, and that will dissipate the trigger point, and it's been known that it's effective in doing so. That's a direct method. Indirectly, you can do gentle stretching with light pressure over a long time in a hold. That can be effective as well. So those are 2 different forms that when you come into clinic, that's what we're going to focus on. And when people are showing, clients are showing those forms of trigger points, that's what we will be focusing on pretty much immediately in the sessions. The second one, so that's the myofascial release. The second one is the soft tissue release, which I mentioned, which is a development on this. So it's also known as a pin and stretch. That includes and involves a passive or active movement of the tissue while performing the techniques that I just mentioned before of deep, slow pressure. Okay, so it's pretty much with trigger points. We know that those are the best forms of therapy that we can give to our clients. But you might not be able to come into clinic, and if that's the case, then what you want to be doing is taking that sort of the soft tissue that I mentioned before, and being able to do this for yourself. You can use massage balls. You can use what we know as foam rollers. You can use that in the gym, as well as stretching. So those are the things that you can do once you have the trigger points. But as I said, it's important that we also need to prevent on top of that. Okay, so that gives you an overview of what trigger points are, what how they're likely to form, and what we can do about them. Okay, so if you have any questions, and I know there was a comment that mentioned it was quite skippy and was going in and out and freezing. If that's the case, then put a comment underneath, and hopefully, for the next time that we do a live, that we can sort that out. But hopefully, that will be it for this live, and hopefully you got a better understanding of what trigger points are. I'll leave a couple of minutes if anyone if they want to leave a comment there to say if it's okay or not. But that'll be it. Okay. Thanks for coming along, guys. Take care.